Ever wonder what it would be like to get up in the morning, walk out the door, and see the world like everyone else does, without glasses or contact lenses?
I couldn't see. I couldn't read a phone book. I couldn't do anything.
I had to have my glasses to see anything and everything.
My eyesight was degenerating to where the distance vision was getting fairly fuzzy and the reading was getting almost impossible.
With my eyes with age began to get problems, glaucoma. He's even had problem with the cornea.
If somebody was across the room and waved to me, I would have no idea who they were.
I've been dependent on contact lens and glasses for over 50 years.
I couldn't take it anymore.
Avery Eye Clinic has been around in some way, shape, or form for the last 30 years here in Conroe. It's one of the most established eye surgery practices in the area.
And the good part that every single time I come, it has been taken care of. The greatest, I call them my family, that are here because they are everyone. It has been wonderful, and that's never been an exception.
I was told I was never a good candidate. And then I come here, and it was just wonderful from day one.
Fearful of the procedure, I think, probably like most people, but it just came to a point where the glasses were just annoying me. And I just all of a sudden said, you know what, it's time. I'm going to do it.
To come here and just try, and to be greeted by such wonderful people and such care, and such willingness to help. It was just unbelievable.
It is great to know that you can get excellent eye care right here in your own backyard.
My father, who has since passed away, saw a doctor here who was wonderful. The staff was wonderful, so when I decided to have LASIK, I decided I wanted to come here.
Here at Avery Eye Clinic, we do pretty much a little bit of everything for the general ophthalmologist. We take a look at kids, we do contacts, we do glasses, we do cataract surgery, glaucoma surgeries, lasers. We monitor for diabetes eye changes, monitor for macular degeneration. Mostly, I do, general ophthalmology, we do cataract surgeries, general eye exams, we take a look at kids. I did an extra year of subspecialty training in glaucoma, so I did a fellowship. And so if there's anything that needs to be treated surgically for glaucoma besides lasers, I can take care of that.
The LASIK procedure is an outpatient procedure that's performed under a local topical anesthetic.
In a perfect eye, the cornea, or outer window of the eye, is aspheric or egg-shaped. Light rays entering the center and the outer margins of the cornea all come together to a single point of focus. In some cases, conventional laser vision correction can create a more spherical or round cornea. This can create halos or glare, especially at night. Our wavefront optimized laser places additional laser pulses in the outer margins of the cornea to create a more natural shaped cornea. This allows light rays entering from the center and outer margins of the cornea to come to one point of focus, thereby reducing the incidence of unwanted nighttime visual side effects.
The procedure itself takes minutes, literally minutes, to perform. It consists of two different lasers, one to create a flap that exposes the cornea or the surface of the eye for treatment.
Instead of using a bladed microkeratome, we use our femtosecond laser to create a customized corneal flap of the exact thickness, size, orientation, and location without the use of a blade. This level of control makes LASIK safer and allows more patients to qualify for LASIK.
The second laser then basically will carve the patient's prescription power into the surface of their eye, and then it's covered back over with the flap.
The corneal flap is then folded back. Using measurements from your eye's corneal curvature and biomechanics, the laser removes the corneal tissue necessary to correct your vision while creating a more natural, aspheric shape.
And it was very quick. It took 20 seconds, 30 seconds maybe for each eye. It was a little uncomfortable, but it wasn't painful.
I was nervous, definitely nervous, but it's over so fast.
And had both eyes done at the same time. My right eye for distance, my left eye for reading. and both of them came out 20/20. I'm having very good vision on the distance and very easy to read. I'm very happy and pleased with it.
It was done, and I was on my way home thinking, oh my gosh, this went so much smoother than I thought it would.
Eye conditions that we can treat with LASIK now are nearsightedness, farsightedness, and astigmatism. LASIK has advanced quite a bit in the last several years. We now perform an all-laser procedure where the flap as well as the treatment are both created with lasers. 2 different lasers are used, and it's quite an advanced procedure, and it's now approved for use in military and in NASA astronauts. The advanced multifocal intraocular lens implant is a huge leap in cataract surgery that we've recently got our hands on. The implant allows us to give our patients an option where they can have actually good distance and near vision.
Cataracts are a result of the clear natural lens inside the eye becoming cloudy, brown, or yellow. This causes light to be blocked and scattered by the lens, so it can no longer focus clearly on the retina. Vision becomes blurry, and colors lose their brilliance.
After determining that we had to do cataract surgery to get my mother's vision better, we decided on an advanced multifocal intraocular lens implant because it would give her great vision at all distances.
They gave me the facts about my condition and suggested the advanced multifocal lens. This allows me to see distance as well as up close without wearing glasses.
The only treatment for a cataract is to have the clouded natural lens of the eye removed and then replaced with an implantable intraocular lens, commonly referred to as an IOL.
We kind of came to the decision that I would do the surgery because I didn't really want to trust my mom's eyes to anyone else.
Your doctor will make a tiny incision in your eye using an instrument about the size of a pen tip to gently separate and remove the cataract. Once it's removed, a new lens is inserted that unfolds into its permanent position.
These advanced multifocal lenses work with 2 powers within the lens, so we get both distance and near. The upside of these lenses is many patients can be independent of glasses.
Since I've had the surgery, I am totally independent. Probably the most important thing to me is that I can drive confidently at night. It's very nice to be able to pick up a needle and be able to thread it. I pick up a book and I can read without reaching for readers. It's been just amazing.
I love the family of Avery, and that's what I think of them as. I feel like for the first time, and I've gone to many doctors, not just for eyes, but for a lot of other problems in my life, always dread going. This is the only place I look forward to coming to because I'm coming to see my friends.
Any surgery that you need or any service that you would possibly need for your eyes, this is the place to come.
It's wonderful. I can just do everything that I want to do. Yeah.
Since I play golf quite a bit, I was having trouble seeing the golf ball. Anything over 190, 200 yards, I was having a lot of difficulty seeing the ball. And since I've had the surgery, I can spot the ball very easily at 200, 220, 30 yards. And so I'm very pleased with that part of it.
I saw the very bottom line. I saw as far down as you could get the very next day.
The results have been spectacular, and Dr. DeJean has exceeded my expectations.
In fact, the friend that took me that day, she wears contacts. And so I think it kind of made a believer out of her. And so she said that in the near future, she will be doing it all.